Can you tell me what is addiction and alcoholism?
The term addiction really is an old term now, and when medical professionals talk about drug use, they talk about abuse and they talk about dependency. So our new word for addiction is dependency. And the way to think about it is that there are many people who abuse drugs. They may drink too much at a party, they may drink too often during the week, and it may start to have problems with their lives. And at that level, we would typically call it abuse. And what makes it different than dependency is that when we say that someone's addicted or that they're dependent on a drug, what we're saying is that one of three things is happening. The first is that they've developed tolerance to the drug. That means that they have to take more and more of the drug to get to the same effect. So someone develops tolerance when they chronically use a drug. And you can see that with alcohol, you can see it with cocaine, you can see it with opiates, that the drug doesn't have the same effect over time. The second thing is preoccupation or craving. So the person becomes preoccupied with getting and using the drug to the detriment of other things in their lives. The casual social user, the person who drinks alcohol at a party on the weekend, doesn't experience craving. They don't start their day thinking about when am I going to have my next drink or when am I going to have my next line of cocaine. If it's available, they have a drink and maybe they feel a buzz, but they don't experience this preoccupation with getting the drug. So that's the second part of dependency. And the third part of dependency is withdrawal syndromes. So that some drugs have very profound withdrawal syndromes. And again, not every drug does, but the most profound withdrawal syndromes we see tend to be with things like alcohol, where when you stop it, you have tremulousness, high blood pressure, sweating, seizures, delirium. So that the idea that when people are dependent, they may have withdrawal from those drugs.
Can you tell me how the alcoholic brain functions differently than someone who is not an alcoholic or drug addict?
Absolutely. And it's a really good question. But the way to think about it is that our bodies try to maintain equilibrium in the face of all the things we throw at it. So what happens in the alcoholic brain is that the brain is trying to compensate for the effects of alcohol. And alcohol has a number of different effects. So one effect of alcohol is that it tends to be sedating. And so the body says, whoa, I've got way too much sedation around. I have to do something about it. So a lot of the injury that occurs with alcohol occurs as people stop. Now you say, well, what happens if I never stop? But the truth is, people stop every night. When they go to sleep, they're not drinking. And so every day in an alcoholic's life involves some amount of withdrawal.
Are people born alcoholic, or do they become alcoholic through events or circumstances that happen throughout their lives?
Well, we think that both genetics and events influence whether somebody becomes an alcoholic or drug dependent. And some of the genetics could be a direct effect of genetics, and some of those effects may be indirect. And let me give you two examples. We know that in certain populations, if they are rapid metabolizers of alcohol, they have a certain version of the enzyme that breaks down alcohol quickly, then they're much more likely to become alcoholic. And we think it's because they don't get the toxic effects of alcohol, and they get a bigger high because they're able to clear it faster. So there, it's a direct effect. A single enzyme involved in a pathway that relates to alcohol causes a greater risk. But there are also indirect ways that people can be genetically at risk to become dependent on alcohol or another drug. We know that people with depression, bipolar disorder, anxiety disorders like social anxiety disorder or panic disorder have a much higher risk of developing a drug or alcohol problem. 50% abuse drugs or alcohol. And there, they may have inherited the genetics for those other psychiatric disorders, but where it puts them at risk to develop a drug or alcohol problem. So there, it's still genetic, but it's indirect. It's not related to the specific drug, but it's related to another psychiatric disorder. The third way in which we think genetics plays a role is that there's a lot of evidence now that people who become drug or alcohol dependent have a greater degree of impulsivity. That you can show that impulsivity in experimental tests, and you can see that impulsivity using similar tests in their children. And so we think that in that case, the person is inheriting a behavioral style toward being impulsive, which then contributes to their becoming alcoholic or drug abusing later in life.
Why is addiction called a progressive illness?
Well, the effects of a drug tend to be cumulative on the nervous system and on the individual's behaviors. When we say it's a progressive disease, part of that has to do with the physical consequences of the disease. So the alcoholic may start off, being able to tolerate the amount of alcohol that they're using, but then they start to have memory problems as a result of the progressive insults from the alcohol. They develop vitamin deficiencies, which cause neuropathies, and now they have numbness and they can't walk well. They have problems with their heart. Alcohol weakens the heart muscle, so they develop congestive heart failure from having their heart muscle weaken. Alcohol is toxic to the liver, so the liver starts to break down, and over time they develop cirrhosis. The other thing that happens is that people who abuse drugs engage in dangerous behaviors that increase their risk of other medical diseases. Hepatitis B, hepatitis C, HIV. If they're shooting drugs, like shooting heroin, then they run the risk of having heart infections from seeding their heart valves with bacteria. So the progression of the disease is in part physical. So we talk about progression, we're talking about the physical progression of the manifestations. But it's also psychological, that as people become more and more preoccupied with drugs, they pay less and less attention to the other things in their lives. So the person who used to work is not able to stick to a schedule and go to work every day. We work with young adults who we're trying to get back into the workforce. What we hear is, well, I went to work 2 days in a row. Why do I have to go on Wednesday? I was there Monday and Tuesday. It's as though they've forgotten that when you work, you're expected to be there every day. So there's a progressive social disruption. The other thing that happens is that as people use drugs chronically, they only tend to hang out with other people who are using drugs. People who have other things going on in their lives are not interested in hanging around with someone who's stoned out. And so their social circle becomes more and more involved with drugs. So they have less and less that connects them to the real world. And so one of the things that happens is that they become alienated from their family, from their friends, from their spouses, because they're just not interested in their lifestyle. So when you talk about progression, there's the physical progression of the disease, there's the tolerance that it takes more and more drug to get the same high, and then there's the social disruption in their life, which tends to get worse and worse over time.